Hi, I'm Bo Walpole. I am Vice President of Medical Affairs at Northeast Georgia Health System, and I also work as the Director for the Cardiovascular Summit. The issue of clinical and financial variability has really become a hot topic lately, and I think the biggest thing that I can say at this point is the first thing you need to do is you need to find your data. So on the side of quality, you need to look at those issues that address the quality of your entire program and the things that are causing variability in the quality and the outcomes of the cases you're taking care of. And on the cost side, the same thing is true. You really need to look at the exact costs of the care that you're rendering, and then begin to look at changing process so that the quality is maintained or improved, but the cost is reduced. And it is this change in our process that really is the crux of the value-based model going forward. As we all work together, we've got to push on these things so that we can create high-quality care for less cost, and we have to do it as a team in the future. As you address the issues of quality and cost in the QPP system, it will be very important that you look at these numbers and follow them long-term, because in the future, in a value-based world, your compensation will be affected by hitting certain quality metrics and by hitting certain cost reduction methods. And so your practice will be affected by all the methods that you use, and everyone that touches your patient as far as a provider will be involved. So it's important as a group that you cut out a lot of the variability in care so that you only use those processes that give high quality care for lower cost. And this is going to impact your numbers in the QPP system compared to other providers, and it also will impact whether you receive a bonus for the care you render or that you actually pay money back in certain circumstances. As you and your partners begin to try to deal with all these new rules in QPP, there are probably three general things that you can do to improve your chances to succeed here. The first is get involved in creating care pathways for your patients. You want to look at all the ways to take care of a certain type of illness and use the data to find the best way to do that so that everyone in your practice is doing pretty much the same thing. The second thing you want to do is look at your data and collect metrics that you can look at on a regular basis. You need to follow these metrics so that you know that the quality you're giving and the cost that it's costing you to give that care is in line with where you want to go. And then finally, I think communication is really important. We do not communicate as well as we should among providers and also among the business people in our practice. So communication is another part that will really enhance whether you can succeed in the QPP system.